In this video, we are going to discuss about the blood pressure elaborately. Please be patient and watch the video till the end to get the full information of the subject. Before we go into the video, please subscribe, like and share with your near and dear. In the beginning, when is this blood pressure was recognized in the human history? The concept of blood pressure has been recognized in human history for centuries, although the methods and devices used to measure it have evolved over time. In ancient Greece, the physician Hippocrates described the pulse as a reflection of the heart's activity, which is closely related to blood pressure. The Greek physician Galen, who lived in the 2nd century AD, believed that blood was produced in the liver and circulated through the body to nourish the organs. In the Middle Ages, Arabic physician Ibn al-Nafis described the circulation of blood through the lungs and the concept of pulmonary circulation, which helped to lay the foundation for a better understanding of blood pressure. The first recorded measurements of blood pressure were performed in the 17th century by the English physician Stephen Hales. He used a glass tube inserted into a horse's artery to measure the force of the blood flow. The modern understanding of blood pressure and its importance to overall health emerged in the 19th century. The Italian physician Riva Rocci developed the first cuff-based sphygmomanometer, which allowed for non-invasive measurement of blood pressure in humans. Since then, the study of blood pressure and its management has continued to evolve, with new technologies and treatments being developed to help prevent and manage hypertension. Today, blood pressure is recognized as an essential vital sign in clinical settings, and regular monitoring is recommended for all adults to help maintain overall cardiovascular health. What is the definition of blood pressure? Blood pressure is a measurement of the force exerted by circulating blood against the walls of the arteries. It is typically expressed as two numbers. The systolic pressure, the higher number, represents the pressure in the arteries when the heart contracts and pumps blood, while the diastolic pressure, the lower number, represents the pressure in the arteries when the heart is at rest between beats. Blood pressure is measured in millimeters of mercury, mmHg, and is an important indicator of cardiovascular health. High blood pressure, also known as hypertension, can increase the risk of heart attack, stroke, and other health problems, while low blood pressure, also known as hypotension, can lead to fainting, dizziness, and other symptoms. What are the reasons for blood pressure? Blood pressure is a vital sign that measures the force exerted by circulating blood against the walls of the arteries. It is an essential indicator of overall health, and maintaining healthy blood pressure is crucial to prevent various health problems. High blood pressure, or hypertension, can lead to serious health issues such as heart disease, stroke, and kidney failure. On the other hand, low blood pressure, or hypotension, can cause dizziness, fainting, and other symptoms. We will discuss the reasons for blood pressure, preventive measures, treatment without medicines, food, and lifestyle to control, eradicate blood pressure, and the side effects of blood pressure. Reasons for blood pressure. There are various reasons for high blood pressure, including genetics, age, lifestyle choices, and underlying health conditions. Some of the most common reasons for high blood pressure include age. As people age, their blood vessels become less flexible, which can lead to higher blood pressure. Genetics. High blood pressure can run in families. If one or both parents have high blood pressure, it increases the likelihood of their children developing high blood pressure. Lifestyle choices. Unhealthy lifestyle choices such as lack of physical activity, unhealthy diet, alcohol consumption, and smoking can contribute to high blood pressure. Health conditions. Certain health conditions such as kidney disease, diabetes, and sleep apnea can lead to high blood pressure. What are the preventive measures for blood pressure? Maintaining healthy blood pressure levels can be achieved through various preventive measures, including regular exercise. Regular physical activity can help reduce blood pressure and improve overall cardiovascular health. Healthy diet. Eating a balanced diet that is low in salt, saturated and trans fats, and high in fruits, vegetables, and whole grains can help maintain healthy blood pressure. Limit alcohol and caffeine. Excessive consumption of alcohol and caffeine can increase blood pressure. Limiting the consumption of these beverages can help maintain healthy blood pressure. Manage stress. Chronic stress can lead to high blood pressure. Engaging in stress-reducing activities such as meditation, yoga, or deep breathing exercises can help manage stress and maintain healthy blood pressure. Treatment without medicines. There are several ways to manage blood pressure without the use of medications, including weight loss. Losing excess weight can help lower blood pressure levels. Maintaining a healthy weight through regular physical activity and healthy eating habits can help manage blood pressure levels. Quit smoking. Quitting smoking can help reduce blood pressure levels and improve overall cardiovascular health. Reduce sodium intake. Limiting salt intake can help lower blood pressure. Processed and packaged foods often contain high levels of sodium, so it's important to read food labels and choose low-sodium options. Increase potassium intake. Potassium can help lower blood pressure levels. Foods high in potassium include bananas, spinach, avocado, and sweet potatoes. Food and lifestyle to control, eradicate blood pressure. Several foods and lifestyle changes can help control or eradicate blood pressure, including DASH diet. The dietary approaches to stop hypertension. DASH diet emphasizes a diet rich in fruits, vegetables, whole grains, and low-fat dairy products, and limited in saturated and trans fats. Exercise. Regular physical activity such as brisk walking, swimming, cycling, or dancing can help lower blood pressure levels. Reduce stress. Engaging in stress-reducing activities such as meditation, deep breathing, or yoga can help manage stress and maintain healthy blood pressure. Limit alcohol intake. Excessive alcohol consumption can increase blood pressure levels. Limiting alcohol intake can help manage blood pressure levels. Get enough sleep. Getting enough sleep is crucial for maintaining healthy blood. Are there any case studies? Yes, there have been numerous case studies conducted on blood pressure that have yielded important results in understanding the management and treatment of hypertension. Here are some examples. The SPRINT trial. This study, conducted in 2015, involved more than 9,000 participants with hypertension and high cardiovascular disease risk. The study compared intensive blood pressure lowering, systolic blood pressure goal of less than 120 mm Hg, with standard blood pressure lowering, systolic blood pressure goal of less than 140 mm Hg. The results showed that intensive blood pressure lowering led to a significant reduction in the risk of cardiovascular events, such as heart attack and stroke, as well as a reduced risk of death. The DASH study. This study, conducted in the 1990s, examined the effects of the DASH diet, dietary approaches to stop hypertension, on blood pressure in adults with hypertension. The study found that the DASH diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy, significantly lowered blood pressure, particularly in participants with high blood pressure. The PREMIER trial. This study, conducted in the early 2000s, evaluated the effects of lifestyle modifications on blood pressure in participants with prehypertension, systolic blood pressure between 120 to 139 mm Hg or diastolic blood pressure between 80 to 89 mm Hg. The study included interventions such as the DASH diet, weight loss, physical activity, and reduced sodium intake. The results showed that lifestyle modifications significantly lowered blood pressure, with the most significant reductions observed in participants who followed multiple interventions. The TOMHS study. This study, conducted in the 1980s, examined the effects of medication on blood pressure in participants with mild to moderate hypertension. The study found that blood pressure-lowering medications, including diuretics and beta blockers, significantly reduced blood pressure and lowered the risk of cardiovascular events. These case studies highlight the importance of managing blood pressure through lifestyle modifications, such as diet and exercise, as well as through medication when necessary. They also provide important insights into the long-term effects of blood pressure management on overall cardiovascular health. Based on the above case studies, what are the preventive measures to be taken to prevent the high blood pressure? Based on the above case studies, There are several precautions and preventive measures that an average person can take to manage and prevent high blood pressure. These measures include: maintain a healthy weight. Being overweight or obese can increase the risk of high blood pressure. Maintaining a healthy weight through regular physical activity and healthy eating habits can help manage blood pressure levels. Adopt a healthy diet. A healthy diet that is low in sodium, saturated and trans fats, and high in fruits, vegetables, whole grains, and lean protein can help maintain healthy blood pressure levels. The DASH diet, which has been shown to be effective in lowering blood pressure, emphasizes a diet rich in fruits, vegetables, whole grains, and low-fat dairy products, and limited in saturated and trans fats. Engage in regular physical activity. Regular physical activity, such as brisk walking, swimming, cycling, or dancing, can help lower blood pressure levels. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week for adults. Limit sodium intake. Limiting salt intake can help lower blood pressure. Processed and packaged foods often contain high levels of sodium, so it's important to read food labels and choose low-sodium options. The American Heart Association recommends no more than 2,300 milligrams of sodium per day for adults. Limit alcohol consumption. Excessive alcohol consumption can increase blood pressure levels. The American Heart Association recommends no more than 1 drink per day for women and no more than 2 drinks per day for men. Manage stress. Chronic stress can lead to high blood pressure. Engaging in stress-reducing activities such as meditation, deep breathing, or yoga can help manage stress and maintain healthy blood pressure. Quit smoking. Smoking can increase blood pressure levels and contribute to various health problems. Quitting smoking can help reduce blood pressure levels and improve overall cardiovascular health. Take blood pressure medications as prescribed. For those with hypertension, taking blood pressure medications as prescribed by a healthcare provider can help manage blood pressure levels and reduce the risk of cardiovascular events. By implementing these preventive measures, an average person can help maintain healthy blood pressure levels and reduce the risk of hypertension and other cardiovascular health problems. It's important to note that these preventive measures are not only effective in managing blood pressure but also in improving overall health and well-being. A healthy diet, regular physical activity, and stress management can help reduce the risk of numerous health problems, such as obesity, type 2 diabetes, and heart disease. Additionally, regular blood pressure monitoring is important to detect and manage high blood pressure early. Healthcare providers can provide guidance on blood pressure monitoring and offer recommendations for lifestyle modifications or medication if necessary. In conclusion, maintaining healthy blood pressure levels is crucial for overall cardiovascular health. By adopting a healthy lifestyle, including a balanced diet, regular physical activity, stress management, and limited alcohol and sodium intake, an average person can help manage and prevent high blood pressure. Taking preventive measures can not only improve blood pressure but also contribute to overall health and well-being. Please make sure to subscribe, like and share with your near and dear. Thanks for watching.